Hi everyone and welcome to my channel. In today's video I am going to be talking about how to prepare for the clinical scenario part of the anaesthetics interview. Alright, so if you haven't watched my previous videos, I've been talking about how to get into anaesthetics training step by step, and today I'm going to be talking about the clinical scenarios specifically. The anaesthetic interview itself is 30 minutes and it's divided into two parts. First is 15 minutes of clinical scenario, and then there's second part which is 15 minutes of your portfolio based questions. Obviously in this video I'm going to be focusing on the clinical scenario bits. I'm going to be talking about how to prepare for it, what are the questions that may come, and then finally at the end of this video I'll be doing a short demonstration of how to actually answer and how to structure your answers with regards to whatever questions you're going to get. So let's dive into the structure of the clinical scenario bit. So once you've booked your interview through the slots that are given after the MSRE exam result comes out, you will then book it based on the deaneries. It doesn't matter what deanery you book because it's a national interview, so it doesn't really matter the location or wherever you're going to be attempting your interview on. It is going to be online and you're going to have to sign a waiver or declaration before you actually appear for your interview. Make sure that you check your spam folders because sometimes the declaration comes there, and if you haven't signed the declaration then you're not allowed to appear in the clinical interview. Now, so how is it going to happen? What is the structure? You're going to be given a set of one-liner or two-liner scenario. You're going to be allowed to have 2 minutes to prepare yourself for the scenario itself, and then you will enter the meeting room, which is going to be online. You'll have 2 examiners and 1 lay person who is going to be a moderator, just for the sake of fairness. Once you're done with that, you will then begin the clinical scenario part of your interview. You will then be judged on the different aspects within the clinical scenarios. These include working under pressure, decision making, team working, reflective practice, and all of these combine together to give you the clinical scenario point. The overall interview for the 15 minutes of clinical scenario is 40 points, and then obviously they will also be using the global rating part during this part of the interview. Alright, so what happens in the interview? Once you've read the scenario, which is before your interview begins, so it's outside the 15 minutes, you will then have 2 minutes, you'll have a pen and paper, and then you can prepare your answers accordingly. What I did was prepare my answers way before I actually began my interview. So yes, they want to know your A2E assessment, but you need to know other things as well before you jump into the interview scenario. So these 2 minutes that you have to prepare yourself for your answer are really crucial, and you should know exactly what you're going to say when your 15-minute begins, because you don't want to be flustered. You want to show that you're a calm individual, you can work under pressure, and there are certain things and sentences that you can include in your answer which will then give you points for team working or decision making or safe escalation, those kind of things. There is a matrix on the end. Sorry about that. There is a matrix on the NRA website that you can check out. I'll put the slide in here as well, and you'll be judged on all of these aspects. There is an interview course that happens every year for the first round. Usually it happened for the second round as well, but this year they're not conducting that round. The course is Anaesthetics interview. I will link down the site below. It is a bit expensive, around £195, £200, £200, but I highly recommend it because not only do you go through the interview structure, what is expected of you, but I also give you points on how to prepare by yourself. Another tip I would like to say is that make sure you prepare with somebody in real life, and also have a setup for your online interview, because the interview is going to be online and you want to be comfortable when you're appearing on a camera and not looking here and there or above or below. You should be looking in the camera and the eyesight and those kind of things. I'll be making a separate video on how to appear in an online interview, just to give you generic guides and tips on how to do it in the best possible way. But now let's jump on the clinical scenario and I'll show you guys how I answered my questions and how to basically score maximum points in these 15 minutes. Alright, so on the screen right now there's a scenario, and you won't get a lot of specifics in the basic clinical scenario that you're provided, simply because they wanted to keep it open kind of a scenario. They want to see where you take the scenario. And that's exactly what happened with me. I'm not allowed to discuss what happened in my scenarios, simply because I've signed that declaration form. But this is a generic sort of a scenario. I've just taken it out of one of the Oxford Handbook books. So this isn't my questions. This isn't related to my interview, just so that it's out there. But it's like an example that I'll be answering so that you guys know how to structure your answers. So we've got a 40-year-old male who's a post-op day case 1 and is complaining of lightheadedness. So you've got 2 minutes. During these 2 minutes, yes, you are going to start by doing your A to E assessment. So you're going to be doing the airway, breathing, circulation, drugs and GCS and glucose for your D parts, and then exposure. What I did was use a pen and paper and I wrote down what I'm going to say during this A to E assessment. So I wrote down A, airway, SATs, monitoring, B, chest examination, auscultation, breathing, respirate, those kind of things. C, other monitorings that has been left, like BP, ABG, bloods, 2 large bore cannulas if I want to give fluids right now, those kind of things. Then D, drugs, glucose, temperature. Then E, exposure, wounds, those kind of things, because this is a post-op day case. So once I wrote that down, the next thing I wrote down in these 2 minutes was my DDs. So having differentials really helps in going through the management. So my differentials for this is bleeding, sepsis, hypotension, and hypoglycemia. I wrote down hypotension and hypoglycemia. These are not diagnoses, but things that you can treat in emergency situations, and often really missed because we don't really check the BMs of a patient who's going under, especially if they're hypotensive. Our mind directly goes towards that and not other things. So I wrote down bleeding and sepsis. Bleeding and sepsis are my 2 things because it's post-op day case 1. Either the wound is dehiscent and it's bleeding, or the patient has an infection and they're currently in sepsis. The next thing I wrote down were things that I have to include in my answer, which includes thanking the nurse, asking a junior to do things for you, escalating rightly towards the seniors, calling a mid-reg, calling the ICU, and calling out a peri-arrest. So these are all the possible things that could happen within the 15 minutes. And during my 2 minutes, I wrote all of this down because I didn't want to miss any of the important points. In my personal scenario, which I'm not allowed to talk about, it was an emergency scenario and it wasn't starting with an emergency. So what they're trying to do basically is to see how you respond to emergency scenarios. So the scenario would begin with a stable patient or a patient who may or may not be stable, and you're supposed to find it out, and then they would quickly drastically change it just so that they could kind of test you how you work under pressure, whether you have good decision making skills, whether you are a team player and you include other people in your decision making, and whether you're a safe doctor. So for all of these things, which are part of the interview matrix on Andro, you have to kind of understand that these are kind of the things that would come in the scenario. And now I'm going to be answering the question, so let's begin. I would start by thanking the nurse for letting me know about the patient. I would inform her that I am urgently going to assess this patient and I'm on my way. If it's possible, if she could attach all the possible monitoring to the patient while I'm on my way and let me know as soon as possible. I would once again thank her and then quickly go towards my patient. I would go to the patient's bedside, take consent if they are having a proper GCS, and let them know who I am. I would also see who are my team members at this moment, and I will begin my A2E assessment. I would assess the patient's airway. If they are talking to me, that means their airway is intact. I would ask the nurse to attach some monitoring to the patient, look at the patient's SATs, and also move on to my B. I would auscultate the patient, look at their breathing pattern. I would calculate their respirate, and at this moment I would like to attach oxygen to my patient. If they require oxygen, I would ask one of my juniors to order an X-ray if that is in case necessary at that time period, and I will also ask for an ABG at this point if any of my juniors are able to do one. I will then move on to C. I will assess my patient's circulation, cap refill time, peripheries. I will look at my patient's blood pressure, see if they have adequate access. If they don't have adequate access, I would ask one of my junior doctors to establish 2 large bore cannula access and start providing fluid to my patient. If bloods have not been sent so far, I would also ask one of my juniors to send the blood at this time. I'd also let them know if they're unable to do so to let me know so that I could communicate the task to somebody else, or I will assess it myself. For bloods, I would ask for full blood count, UNEs, clotting, ABGs, TRP, and group and safe. Then I will move on to D. I'd ask one of my doctors or anybody there to get the patient's nose and look at the drug chart, see if there's anything that stands out. I'll also look at the patient's BM and the temperature. I would then expose my patient after obtaining consent. I will see the wound side, whether there is oozing, blood, or anything else coming out of the patient. I will also say if their abdomen is soft and tender, if there is bowel sounds present, and at the last I would examine the whole patient, completely exposing them after obtaining consent, and make sure that I have missed nothing. At this moment in time, I believe the patient might either be bleeding or have sepsis. They could even be hypotensive or hypoglycemic. So I will make sure that I received all of the observations and all the blood results as soon as possible. ABG has been sent, so that is something that I will be looking forward to because it will give me immediate information. Alright, so once you've ended this part, it then goes from this part onwards. They could give you blood pressure, they could give you ABG results, they could give you all the information at one point, but usually because they've got 15 minutes, they would take you one by one, gradually deteriorating the patient as they go along. So in this sense, I would give you a few examples of what can happen, and then you can prepare yourself accordingly. But know this, that you've already got things in mind, and you have to make sure that you talk about those points. It is okay to look at the paper when you're taking the interview, but make sure that you're not looking like this and answering. You make sure that you're making some eye contact while you're answering. They know you're nervous, they know a lot rides on this, but make sure that you appear calm and confident. Don't smile way too much, but try to smile a little bit if you can. So they will give you information, say for example, right, your patient is having a blood pressure of 70/40. What would you do next, doctor? And I would say, I can see that this patient is extremely hypotensive, having post-op day 1. This is an extremely concerning point for me because this patient is now in peri-arrest. Therefore, I would like to ask my nurse to call a peri-arrest. This would provide with me other teammates, seniors, and I would be able to escalate safely. I'd also at this moment confirm whether we have 2 large bore access and start providing my patient with fluids. They would stop you here and say, how much fluids would you like to give? And I would suggest saying something like, this patient is 40 years old, and if I have seen the notes by now and they don't have any other comorbidities, I would start by giving them 500 mils of bolus saline or 500 mils of bolus Hartmann's, stat, and I'd repeat it, and then I will reassess my patient. This is an important sentence to say when you're doing an A2E assessment kind of questions, because every time you do an intervention, you need to see whether it has actually helped the patient. So I would suggest saying something like, this patient is 40 years old, they're post-op day 1, they don't have any other comorbidities as far as I'm aware of, so I will provide my patient with 500 mils of stat bolus Hartmann's, and then once I've provided this, I would then reassess my patient's blood pressure. This is good answer. They'll move on. They will say, okay, yeah, you now have a VBG that has come back and it shows, I don't know, hemoglobin of 50. And at this point you would be like, okay, so this patient looks like it possibly may be bleeding. I would check the notes to see what was their post-op bloods. And once I've assessed that this is most definitely bleeding, I would then activate the major hemorrhage protocol. So at this point in your scenario, you have not only established the patient is in peri-arrest, but you also have started the major hemorrhage protocol. So it's gone up the roof, you've hit your mark, you can't go above that. So they will switch the scenario towards, okay, what would you do next? So at this point onwards, you would say something like, I've already sent bloods, I've already sent a group and save, so hopefully blood's going to be on its way. In the meantime, I would again give my patient another set of 1 liter fluid just to maintain their blood pressure. Hopefully by this time, I would have a senior in place, either a med reg or an ICU registrar, and I would decide to hand over the patient to them. Sometimes during these scenarios, they would say, no one has responded yet, or you're very far away, or you're out of hours and everybody else is busy. What would you do next? This is where they're trying to judge you and say, oh, you're not going to freak out, right? So if this happens, you would then go again, say, I'll redo my A2E assessment, find out what my current patient's stats are, find out what their hemodynamic status is, give them blood, give them fluids, and I will have to talk to the anesthetist on call. I would have to inform the surgical registrar on call. I would have to inform, and then they could stop you and say, oh, there is no surgical registrar, or they're not responding. So you have to immediately, that's fine. I will then talk to my surgical consultant on call and the anesthetic consultant on call, because this patient may require urgent theater. And at this point in time, they would then end your scenario. So I'm not saying this is the scenario we're going to get, but this is the kind of scenario which is most definitely going to happen. So it could be a surgical patient, it could be anaphylaxis, it could be a peri-arrest situation already, it could be a trauma patient. So there is no sort of like there's no fixed scenario that can happen. But hopefully the way I've answered the question, you can understand how calm you have to be. You have to involve thanking the nurse, asking junior doctors, escalating to the right seniors, and stay calm, because you have to tick all of the boxes that the interview matrix has already put on the Endo website. And yeah, you guys, this is the end of the video. I hope that you guys liked the video. Give the video a huge thumbs up and subscribe to my channel if you have not already. And if you have any other questions regarding clinical scenario bits or portfolio, or if you want one-on-one preparation tips, please let me know. If you want, just leave it down in the comments below and I shall respond to you. And yeah, I hope that you guys like this video. Give the video a huge thumbs up and I will see you guys in my next video. Bye!